This is collaborative assignment number 1, tooth anatomy and scaling of the maxillary and mandibular incisors, Janelle and Leo. The maxillary central incisors, the specific morphology for these is that they have a bulbous crown, no prominent concavities except possibly on the lingual surface of the crown near the cingulum. The root length is 13 millimeters. The maxillary lateral incisors have a distal lingual marginal groove, a palatal gingival groove, a lingual groove horizontal which separates the cingulum from the lingual fossa, and the lingual gingival groove vertical from the pit. The root length for this is also 13 millimeters. Mandibular central incisors have a possible shallow concavity on the proximal root surfaces, small crown and root, making it difficult to adapt for instrumentation. The root length of these is 12.5 millimeters.
For mandibular lateral incisors, there are possible concavities on the proximal root surface, giving a double-rooted appearance. They also have a small crown and root, making it difficult to adapt. The dimensions are typically a root length of 14 millimeters. So for 1 millimeter of bone loss for the maxillary and mandibular central incisors, the gingiva is typically tighter to the tooth and healthier. So we would use regular instrumentation like our 7/8 sickle and the 5/6 Gracie. Here Janelle is demoing the 7/8 on the mesial and distal surfaces of tooth number 8. It's important to remember when scaling these surfaces to get all the way to the base of the pocket, to not leave any residuals behind, and to maintain adapted while scaling. You can see here how her shank is parallel to the tooth that she's scaling to ensure that she's properly adapted. Here Janelle is scaling tooth number 10 with the 5/6, which again would be appropriate for 1 to 2 millimeters of bone loss. We would scale the direct and interproximal surfaces, starting with towards and the away surfaces. It's important to remember, since incisors are smaller, they're typically harder to adapt. So to ensure we have good adaptation, we want to make sure to have a good fulcrum and lateral pressure to maintain adapted while scaling these teeth. For 3 millimeters of bone loss, we would switch from the 5/6 to the 5/6 mini, as it would adapt better because of its longer terminal shank, and we would continue to go ahead and still use the sickle 7/8 for our mesial and distal surfaces. Here Janelle is using the 5/6 mini, and for 6 millimeters of bone loss, we would still use the 7/8 and the 5/6 mini, as the longer terminal shank is still advantageous, and the thinner blade is going to go ahead and make it so gingival insertion is easier for those deeper pockets. The 5/6 mini is also area specific, so it offers better adaptation and control. Here Janelle is showing adaptation of the 5/6 mini. The goal is to keep the toe 1/3 of the blade on the tooth throughout scaling to ensure proper adaptation. Here we wanted to demonstrate what adapting with the 6/7 sickle would look like. It's important to go ahead and remember that the correct angulation we're looking for is about 45 to 90 degrees to maintain adapted.